Hi, I just wanted to sit down for a couple of minutes before I boost out to do some chores to talk about something called pain drivers. This is something which I come across sort of on a daily basis with a lot of patients, young and old. And basically, pain drivers is just something that's enhancing your pain levels. So, any musculoskeletal presentation like knee pain, shoulder pain, back pain, whether it's osteoarthritis or whether it's a partial Achilles tear or damaged ligament, anything like that, you can potentially have lingering pain which goes on for longer than it should, and pain drivers can be a reason why this is so. Pain drivers can be anything like emotional distress, financial distress, worries, depression, fatigue, so sleep deprivation, and basically everything sort of that's going on in your life, the whole picture really. And a lot of the time patients present and they say, I'm really worried about my knee pain. The GP said that I've got osteoarthritis, and I'm forever going to have these pains. I'll have to deal with it, but manage it with strengthening, etc., etc., which is correct. A lot of time patients aren't informed about the other pain drivers, so especially depression, anxiety, and sleep deprivation. With these, you'll find that your nervous system is super heightened, so you're more sensitive to stimuli or sensitive to anything that you'll touch, lift, and your pain levels is just through the roof. And this is human nature, this is how the nervous system works, and 100% able to tackle issues like this and help reduce pain levels. So, for an example, I recently had a young girl, and she was 23, and she had a young daughter, and she was suffering from really bad lower back pains. So, past medical history, she's healthy, nothing seriously wrong. She had childhood asthma, that was all. And when you kind of probe and ask her a few questions, get to know her a little bit more, find out that she's sort of not very active at all, so a bit deconditioned, which is common. Not everybody is into their fitness. With deconditioning, you have a lot of muscle weakness and weak tendons, and you're just very more susceptible to getting any kind of musculoskeletal pain. So with this particular lady, she had a sort of traumatic background and had a lot of emotional distress going on. So sort of rooting a little bit deeper into her past and her experiences, it was quite obvious that she was still struggling with kind of worries, depression, and also body image. So in general, her mood was low and not very content in general with her life. So that alone, we know, is potentially heightening her pain levels. And quite often a patient just needs a bit of reassurance, education regarding which specific exercises to carry out, and just to make them aware that, okay, you have a lot going on with stress, this, that, and the other. This is potentially contributing to your pain levels. If you can, try fitting something, one thing in a day that you really enjoy doing, or putting time aside for you, whether it's some kind of therapy, whether it's meditation, yoga, or just spending time with a friend or member of family to just chat, is a bit of downtime. It's very important to get that on a daily basis. If you're somebody who's struggling with any depression, anxiety, or past traumatic experiences, somebody who suffers from insomnia, is really struggling to sleep, and putting it all out on the table for them and saying, you can definitely attempt to make some sort of lifestyle changes and make some goals which will enable you to improve your quality of life. And then after a few weeks, it's quite often we notice pain levels start to subside, they start to reduce. Sometimes pain diminishes altogether when we get to the root of the problem. But so massively, your mental health, it's very important that you're quite open when discussing any kind of musculoskeletal pain or injuries in general. And it's something which is just becoming more and more common in our generation, with all the pressures of society and everything like that. So lifestyle changes, looking at the whole picture and speaking to somebody, getting a little bit more advice, really can help you reduce your pain levels. With the sleep deprivation, I'm quite lucky. I never had any problems with sleeping. I'll pass out straight away. Not the case with a lot of people. And a lot of patients have come in saying they only sleep 4 to 5 hours a night, which I personally don't think is enough. So what happens is you've got reduced serotonin levels in your system, and serotonin is what kind of enhances mood, keeps pain at bay. So when you're not getting enough sleep, you're fatigued and tired, obviously not feeling great, your pain levels just go through the roof. So keep in mind that it's really important to get at least 6 to 8 hours sleep every night. Integrating something into your day which is a hobby, something fun, or a bit of downtime, or just speaking to a family member or friend, getting that little bit of social interaction is really important as well. And you're tackling sort of different aspects in your life, which could enable you to reduce any kind of pain levels you might have, but improve your quality of life as well. So anybody who might be listening who doesn't have any pains or injuries at the moment, it's just really useful to bear in mind that all the external stresses and pressures that goes on in your life massively impacts on your body, both at a physiological level and a mental level. So I really do like to spend a lot of time with each of my patients, which presents with a bit of both, so suffering from sort of mental health issues as well as multiple joint musculoskeletal pain or acute injuries. I really like to home in on their own personal world and anything that's potentially going to inhibit physiotherapy or their recovery. So must go now, but yeah, so have a lovely day. That's it.